Got a nice picture.
Hello.
Morning, Mike.
Hi, John.
Got that copacetic. How you doing there, Madam Clerk?
I'd maybe have a couple of comments during public comment or whatever.
Yeah, I'll recognize you for that. I think our Madam Clerk is something. Morning. I think there's some agenda. Have you got an agenda? Kind of public comment from Bob. How's our counselor? How's our counselor? What are you guys working on?
The WebEx.
Seems to be a hang up every time, doesn't it?
This is the one. I can get over here.
You need to start that.
And I've also.
One more pair of hands to do vaccination.
Yeah.
It's coming, right?
Yeah, it is.
John, when you going back to Arizona?
Good.
Got here last night. I'm going back next week. Right after the meeting Tuesday night.
Has it been warm down there?
Yeah. It's good. Supposed to be this Friday. It's supposed to be 79 or 80.
You look tan. You
You know what?
don't look like you've been living in the Wisconsin winters with us.
Keep busy, I'll tell you.
Oh, right.
That's super, isn't it?
You know if Rob got home, Rita?
I tried to call last night and I haven't heard back from Mary Beth. I called several times yesterday, but I'm talking with Mom's doctor right now.
Yes, they got his heart back in rhythm.
Yeah, that's the thing. He's gonna get an ablation, but I'm talking with Mom's doctor about getting home care to come in right now.
Yeah.
You know, because she gets it.
Uh,
I think Darlene's not joining until 3:15.
Kay Lehman and some of the girls are getting together today to help her out.
Oh, I'm so glad to hear that, because she just doesn't ask. She needs to.
Kelly's gonna take her someplace tomorrow.
Get her car, to get her car and to get her injection.
Yeah.
If I get that.
I got my shot down there.
Yeah.
What her mom?
Yeah, I took her. And they weren't busy at all and they said they had some cancellations and they asked me
We can probably.
if I wanted to get mine and I said, well, sure. And so I filled out the form and I didn't even feel them do it.
Sabrina's pulled over. And do we know if Dr. Lagas?
Yeah, it worked nice.
Right.
You had yours, Joe?
I'm probably last on the list.
20 blah, blah, blah?
I'm a lost case.
No, you're not. You're in the, you're gonna be in the next phase. You know.
Yeah, you are.
Medically, I'm not good.
I know, that's why we can get going. Are you helping that at all? Are
they bringing?
I am helping.
Okay, I guess we're far enough along, so I'll call the meeting to order again. And, number 2, approval of the agenda as presented. Any changes or, I don't think so.
So moved.
Second.
Motion and seconded by Supervisor Hemling and Middleton, Amy Middleton. You got it, Madam Clerk? All in favor, say aye. Motion carried. Approval of minutes of December 8th, 2020 meeting. They were sent out. Motion for approval?
Make a motion, we approve the minutes of December 18th, is that what you said?
December 8th, I believe.
8th, okay.
Second?
I'll second that.
Motion made and seconded. Any questions? All in favor, say aye.
Aye.
Motion carried unanimous. Public comments, Madam Clerk, do you have anything? There's a handout by Bob Blake, our former county chair. I haven't had a chance to read it, but I think everybody just picks one up there on the table over there by our Madam Clerk, and you can take a public comment home with you.
I believe they were emailed out as well.
Oh, okay. I didn't happen to get one. Number 5,
I think
receipt.
Mr. Pritchard has public comment. Did he say that?
Pardon?
Did Mr. Pritchard want to speak public comment?
Well, supervisors don't speak under public
okay.
comments. But I will, Mike, I will recognize you as we progress here. The supervisors aren't allowed to speak under public comment or answer for that matter. Recep supervisor not seated, don't see anything.
That's your speak.
Mike, did you have something you wanted to address? You can do that now. Want to contact him, Madam Clerk?
You let Mr. Pritchard speak.
Okay.
Go ahead, Mike.
Thank you, John, and thank you, board. My comments will relate to the COVID-19 update and may well be answered or covered by the report for the COVID-19 update. Tanya was good enough to return a phone call I made right at the end of the year inquiring about the rollout of the vaccination program. And I'm wearing a hat, I think, both as a county supervisor looking at what role the county should be playing and can play in the rollout of the COVID-19 vaccination program. And also, personally, I'm in above the age threshold for the preferred group, if you will, and very anxious to get a vaccination. I've talked to some friends in different parts of the country, one living in New York City who has an appointment to, who's 75 years old and has an appointment to be vaccinated this Saturday, and said that New York City had a website listing the locations that were administering vaccinations and contact information. I have a brother who is in his 80s, and he has had his vaccination in Bemidji, and talked to people in Florida, and they are getting vaccination. You see the TV news reports of cars backed up, people waiting many hours to get vaccination. As of December, the end of the year, December 31st, we had almost no vaccine, and I think the St. Croix Clinic has received had received, and maybe so far still has only received 100 doses, which would partially cover vaccinating their staff, the health workers. And I guess the message I want to convey, one, we had the warp speed for the vaccination development, for the vaccine development, but it doesn't seem like Wisconsin at this point at least has a warp speed for the carrying out the vaccination program. I think the county could do a big service by listing sites on a website or a special website that would give people information about how they could get signed up for vaccines. I don't know if the sticking point is that I think at one point they hadn't yet defined who the essential workers were who would get some preference. I'm hoping that Tanya will, or whoever's making the COVID-19 report, will go into this in some detail, and that we can know where we stand, what we're looking at, and have some hope and expectation that we're going to get the vaccination sooner rather than later. Thank you.
Thanks, Mike. I can just give you a little bit of update, and I think it's important for people to encourage people to get the vaccine. There's a lot of people that have even called and gotten appointments and then don't show up. I got mine me and my sister got our vaccination in Chandler, Arizona last week. And we were the first ones there, and there was 10 nurses there. There were six gals and 4 guys, and we were the only ones there for a while, and then there's a few more came, but there's places where you see long lines, and there's places where there isn't anybody, and there's places where there's more vaccine and people aren't even making use of it. And I think it's up to everybody to encourage people to do the best they can. There's just nothing to it. I didn't even feel it. I didn't even stuck it in my arm. I didn't know she even did it. I said, "Are you done?" And then February 13th, you get the second one. And they tell you what kind it is. What are the 2 kinds?
Pfizer and Moderna.
Pfizer and Moderna.
Moderna is the one that we got. They tell you what kind you get. Well, anyway, that's just a little update on that. Tanya, I'll turn that number A over to you. Finalize 21 work plan.
Yes, we're trying to get it so we could share it out with the group, but I believe everybody received it in their packet. The only thing that I will say about the work plan, it changes throughout the year as
it's pretty much a month by month.
As different topics come up, we add them to the work plan. We provide the presentations as needed. The one thing that I will say is that I kept the nuisance human health ordinance work group just for awareness on every month. The update that I can give you on that is that our environmental health team is working on updating the human health hazards. So we are positioned and ready when we do begin work on the nuisance ordinance again. So Brian and Patty are working on what they believe it should look like. And then we'll just give a brief, even if it is, we don't have anything to report, we will update so we don't lose track of it.
Do they give you, the state or somebody give you a report on, like, if vaccines come into the St. Croix Hospital or Amory Hospital?
Yeah, so we can move to the COVID-19 update, and most of my update will be about vaccines, so if you guys are ready for that.
Go ahead and
do
just
that.
go right down the list there.
Okay, all right. So is everybody okay with that work plan? Okay, thank you. So the COVID-19 update. So now we've crossed over in the health department to be more of the connector of vaccine supply to the people who need it. So as you know, there's the state and the CDC has rolled out the different phases. There's phase 1A, which is mostly healthcare workers, long-term care residents. We're seeing that list kind of move around a little bit. Now we noticed that fire departments and police will be added into that group starting next week. So kind of a moving target at this point, but we are taking the list of, as a master of the entire county and working with our 3 health centers on ensuring that the 1A group gets vaccinated first, because we can't move to 1B until the 1A group has been taken care of. We've received pretty strict guidance from the state on that nobody's moving forward until the state ensures that most of our 1A population has been vaccinated. Yeah.
Is it possible to interrupt here just for a second?
Sure.
At the expense of wasting any vaccination from the Pfizer supply, would they be willing to go out of the 1A group to just use them up so they're not wasted?
Yep, so the number one sin is wasting vaccine, is what we've been told. If we get to a point where we've scheduled a clinic of all 1As and we have 4 doses left over, we have permission to put it in an arm. But we can't plan and start marketing and outreaching to 1B groups to come on in and get your vaccine until we've moved through the 1A group first.
Okay, good.
Is the state telling us that the whole state has to complete 1A before someone else can start 1B?
That is the guidance that we have been given.
That might need to be
Yeah, because
discussed.
somebody might be way ahead and, right? That's bad.
So realizing that everybody's at a different stage in the game, we are working very diligently with our health centers, knowing that St. Croix Regional was behind in getting dose. I think they're on the right track now with the survey to order doses. Amory has been good. We've actually sent St. Croix staff down to Amory to get vaccinated. So we've been partnering with the 3 health centers and making sure that we get that 1A group, with us being the keeper of the list. So we don't have dates to project or give to people because we don't know exactly when the state will move to that 1B. The 1B bubble, we're calling it, will be a large group of people. A lot of our social worker staff, teachers, other healthcare personnel are in that group. So we anticipate a pretty large group. But like I said, it's moving around a lot we thought that law enforcement and fire department was going to be in 1B, but now they've kind of been bumped up. They're not being called 1A, but they're in the group with us. So we're busy contacting all of those local municipalities to find out who they have on staff that meets that qualification, so we can batch them out and get them connected with a clinic, as well as Polk County Health Department is also an approved vaccinator site. So we will be taking on vaccination responsibilities as well. So there will be 4 main vaccinators in the county. I believe there's a couple of pharmacies that have signed up, but they're not completed yet as far as being approved. So once they get on, they can do their vaccinations as well.
Is your staff all vaccinated?
We sent the nurses down to Amory last week. They have all received their first dose because they meet that qualification. I did not. I don't meet the qualification yet, so I'm holding out.
Can I ask a quick question on the 1A group before you move off that? Do you have a feel for what % of our county of 1A is done? Is it 70 or 10% or?
We have a graphic that we are working on that we can put on the county website, right on the homepage. Need to run through a few eyeballs first to make sure that it makes sense to people so we can give a percentage of those groups that are done. Of the businesses that we know of. So we've been searching high and low for people we think are in the 1A group that need to be vaccinated and reaching out to them to make sure that they know that they're eligible for vaccine.
Like on 1A group, do you think like our senior centers and that, do you think they're pretty excited or are a lot of them pretty apprehensive?
I think the older population is excited to get it.
They're
We've had
doing
some
okay.
calls. We've had calls from Polk County, Florida, and I think those people would actually drive up here if we gave them. Yeah, because they want it. So yeah, there's a lot of interest, and I think that demographic in the phase 1B will be a busy one for us.
What was interesting to me is like we live in Pinell County, Florida. That's a county seat. and the 1A, and they're going into 1B, and Maricopa County with Phoenix, and that is not having the vaccination yet. They're supposed to start this week. It really goes by county, and
Yep, and I know Wisconsin is somewhat behind in their rollout of the vaccine. We spent a lot of time back and forth with the state to actually become approved, and there's just so much and so many moving parts to this. Everybody is working as fast as they can to become approved, get their clinics set up, and get people vaccinated. The health centers are all good about wanting to partner to realize that 1A group is highest priority, getting them vaccinated so we can move on to the 1B group.
Do you have a feel? Sorry. Do you have a feel for what the holdup is statewide? I mean, it does seem like it's trickling along here a lot slower than. Is it logistics at the state level?
I don't know. I think health departments maybe struggle trying to know exactly what their role is, but now we've been given that guidance of we're the connector. If you're a vaccinator, that's great too, but more so just, taking the information in and distributing it out to the vaccinator sites so we can make sure we have everybody covered, rather than each individual health center doing their own thing.
Amy, it's pretty traditional that things that come out of Madison, in the outlying counties, they trickle down slower. It's unfortunate, but Madison is, I think, always that way in just about any area that I've been familiar with. Still get there.
They've done a good job though, like with the facility my husband is in, they've all been vaccinated.
So that I can speak to that too. Part of the phase 1A is the long-term care residents and their staff, and that's a pharmacy program. So the state contracted with CVS pharmacies and Walgreens pharmacies to take care of those two populations. But believe it or not, we have come across facilities that did not know that existed and they were eligible for that. So we've been connecting them to those pharmacies. We've been given instruction by the state not to vaccinate those until we know for sure that they're not going to be covered by a pharmacy, because I think they've probably already been paid by a capitated rate or something like that. So they don't want us vaccinating when they really should be vaccinating by the pharmacy program.
Got those covered?
Yeah, so no dates. The 75 plus people are in that 1B group. I believe that the hospitals and clinics might pull some demographic information from their electronic health records to get an idea of which of their patients would meet that demographic once we're ready and start reaching out that way. And then, of course, we would have our clinics here because people are calling here too, and we're keeping track of that.
Are we ready for a report then from Bob, environmental specialist?
No, I just have one last question. What do we tell people when we're asked on the streets, which is the common question? I haven't said call Tanya, but what do you want us to tell people?
We want them to call the health department because we need to know that they're out there. So we've agreed to take on that role for the hospitals and clinics. We're telling the hospitals and clinics to send them our way so we can put them into our switch.
Okay. And what number do you want me to give?
8400 number.
It'll be on our end. Are you going to be involved in administering any
I
vaccine?
certainly am available and ready to go.
Here's my arm.
Yes, as soon as I have access to start talking to people. I need to do the right, or within, the public health.
Yeah, if you're hearing of other clinics and hospitals in the area doing other than a 1A group, that's beyond our scope and our control. We know we're following our orders from the state at this point of who we should be vaccinating, and I can't speak for other organizations.
What category does our jail population fall in?
Well, jail population would be probably more in the general population, but the actual officers who are working in the jail are up higher on the criteria list.
Mr. Chair, can I ask one question?
Go ahead, Mike.
A question of when when do you start the 1C? How do you know that 1B is, you have to get everyone in 1B before you start 1C? And how are you going to know if there are people in 1B who don't want to be vaccinated or have chosen not to, or what?
Yeah, the state is giving us the guidance on that. Same with the 1A group. When they say when most are vaccinated in these groups, we can move on to the next phase, and we'll take direction from the state on when they feel that the population has been vaccinated to move on to the next group.
Well, that's a good. Okay, Bob, do you want to address your?
Chairman Bonaparte, are you on 6C?
I can just give you a really quick, the Board of Health and Human Service accomplishments. I thought about it a lot. And in March is when the pandemic hit us. So I would request that we could maybe take that up next month. We could have a little bit of time to be able, or out in a couple months. We don't have a meeting next month, but if you guys are okay with that, we'll table that until a later date.
The more complete we can get everything, the better. Report number 7A. You ready for that one?
Eric will be presenting that.
Eric, we're up to number 7A, report on the Environmental Services Division regarding a groundwater testing. And Bob already did the handout on that, Eric. So I don't know if anything that you have relates to that.
I do. If it's okay, I'd like to just go through that.
You got the floor.
Super.
Appreciate having you, Eric,
Thank you.
and all the work you do.
Thank you very much, and Happy New Year to you all. It's been a month since we presented on this, and at that time, at the December 8th meeting, we were tasked with putting together some options and costs for a groundwater testing effort and what that might look like. So the handout that you've got has 4 options, and I'll just briefly go through those. Option A would be a countywide groundwater information and education effort. So outreach and education, basically. We would expand upon current programming related to groundwater quality within the Public Health and Land and Water Resources Department. We'd organize efforts to educate Polk County residents about groundwater contamination, health concerns. We'd encourage well water testing. This particular option wouldn't include any groundwater testing or cost sharing or incentive payments towards that. It would be simply an outreach effort. We provide point of contact for resources related to best practices in preventing groundwater contamination and points of contact for reclaiming groundwater that may be contaminated if they did some testing. So moving along the table, we could feasibly dedicate 2 staff on an effort of this scale at roughly 100 hours each. These estimates are somewhat generous, so be mindful of that. And these are rough. Labor costs we think would be about $10,000. Material costs for mailing and promotional material or pamphlets and things be about of $17,500. Option B is a little more targeted approach, and we would look at a study very similar to what we did in the Balsam Lake Watershed Project. In 2019, as you remember, we did sampling for 100 wells in that watershed. And so this option would be very similar to that, although we would take another priority watershed within our land and water resource management plan and focus our efforts in that area. As I indicated there, we would have 2 watersheds that we would prefer to do the testing in, Wapagasset Lake and the Apple River flowage. And on the back of this handout, we've got those watershed areas there and kind of how they rank. So it's important to mention that. Within this option, we would be obtaining volunteers for 100 well tests. And we would do some mapping and we'd update our local well testing data in our GIS databases. And again, we would expand outreach and education related to groundwater concerns and contamination and health risks and so forth. Very similar to the outreach and education for option A, so I won't repeat that again. The one thing important to mention for this option and the rest of them would be that all test costs and shipping would be covered for the participants. So we propose that, to receive good participation, there would be an incentive there for people to participate if those costs were covered. We could dedicate 2.5 staff for this scale of a project at 100 hours each, and the labor cost would be $12,500. Material cost would be very similar to option A at $7,500 for a rough estimate of $20,000 for option B. Option C would be taking option B to a little higher scale of 3 watersheds. And again, these would be priority watersheds within our land and water resource management plan. We've done our number 1 priority watershed with well testing. Balsam Lake watershed is our number 1. So we would move to our 2nd, 3rd, and 4th priority watershed. And those are number 2, Horse Lake, Horse Creek, and number 3, Wapagasset Lake, and number 4, Apple River flowage. And I believe the area of those 3 watersheds is roughly, I think, 90,000 acres or something like that. And again, we would aim for 100 well tests within each of those watersheds, so 300 total.
Greg, can I ask you a quick question?
Yeah.
Sorry to interrupt. Can you remind me what the criteria was for these priority rankings?
Yeah, so that's probably a presentation in and of itself.
Oh.
It was a watershed evaluation model that our department developed.
So it's something we went through and it's all
Yes.
codified and we
Yep.
have it articulated somewhere.
Yep, it's
Okay.
a pretty extensive criteria
Okay.
based on characteristics, partner groups, previous work, things like that. So it's a pretty involved model that we created to rank those. So we shouldn't get into that at this time,
That's
but
fine. I just
that's the
I could read it
outcome.
if I want. Yeah.
That's the outcome of the model, and I'd be happy to share some of the metadata behind that if you'd like at some
Yeah, I
point.
would be interested. Yeah.
Okay. So again, we'd be looking at updating local well testing data and our GIS databases with these updated samples. And again, all tests would be covered in this option, and the outreach and education component of sharing the well tests and best practices associated with well water protection and reclamation would all be included into this option. 2.5 staff, 200 hours apiece, roughly $25,000 in staff costs. And for material costs, we would have more well tests. We would have more mailings to do, more outreach and educational pieces. So our material costs would be in the neighborhood of $22,500 for a total project cost of $47,500. Now, option D, that's kind of the countywide testing and information and education effort. This would be the Cadillac version, for lack of a better term. Our goal would be 1,500 well water tests throughout the county. And we would aim for approximately 13% of all of our wells within the county. Most recent data says we have about 11,250 private wells in the county. That's 2017 data. So it's likely we have more now, but that's the information we have. A goal that I would say would be a good one would be to take our 1990 data and go back and randomly select a few of those wells and sample about 400 of those wells again from the 1990 data, just to see trends and the condition of those wells. We'd like to see improvement, obviously. Again, all tests and shipping would be covered by this sort of this option, and again, we would update our maps and GIS databases and have a very robust outreach and education program with this. The one thing that this option includes that none of the others do would be staff support for this widespread testing effort. So there is a limited term employee worked into this, and you know, to do this right and to do it effectively and timely, it would be great to have a dedicated staff person on this project for a while. So you can go through and follow the table for the costs there. I will mention one last thing, that it's going to be very important to protect participation with these types of projects. You know, obviously, well data is somewhat sensitive information, and we want to be very careful about how we present that information in maps and so forth. We want to make sure that we are protecting the citizens that were so generous in participating, and serve that information up in a way that leaves out specifics and doesn't jeopardize future projects like this that we would like to do potentially in the future. So with that, are there any questions? Yes?
What's the number of wells that we tested in 1990? Like, what would be the number that you'd go back to ideally and check in with? Roughly, you know?
Yeah, roughly there was about 1,500 wells that were, well, that's what were tested back in the 90s. If I remember right, there were about 1,500 well test records in that data set. So I would like to see us go back to, you know, 25% of those and test them again. It's all driven by participation. You know, we're not really sure how many of those folks would be interested in participating, but we can set a goal as to how many we would like. But I think we should aim for some, most definitely, and that would give us a good idea of maybe some trends and where our groundwater quality is going.
And 30 years later, how many of the same people even still own the properties?
Very true. That would be a challenge, I think, but we'll give it a shot. We can go by unique well code or address and assume that maybe it's the same well, or at least, you know, maybe drilled to the same level and where the old well was pulling water. So
Do we have any idea of those 1990 people, when, say, we pull our own private drinking water sample, send it in, can those two things get connected?
Not likely. It would be challenging, I think. I don't really see in my mind how how we would be able to do that unless those people were generous enough to submit that information.
So when we submit, that's not cataloged anywhere in some sort of database that's a little bit private or protected?
Well,
Transaction.
so one thing that would be important to mention is if we were to do any sort of well test study, I would like to use the UW Stevens Point well testing lab because their information of the tests that they receive, that information goes to their well water viewer and goes to a statewide database where we can see those results. And Polk County doesn't have a large volume of tests on that database right now. So, we could really, benefit from sending our tests to them and adding to that database, I think.
Eric, this well water topic is on our agenda on the county association, and I'm on that steering committee, and we have another statewide meeting on it'll be by Zoom. We have another statewide meeting, the 11th of March, and this is always something that's brought up by some of the counties. And since like 1990 is the latest countywide we have in Polk County, and things have changed so drastically since then. There's the elimination of atrazine and the minimum tillage. Those two things have just been paramount in helping our groundwater. And the state grants, so there's less money in the state grants. It's not as hot a topic as it used to be. But the state allows 2 grants every year for this countywide, which if we're going to have a countywide, that's what we need. We need a state grant, and I think you have an application for that every year, don't you, Bob? And St. Croix County, and I believe was it Vilas County, they got the 2 grants for this year, and we're joining St. Croix County. So when they get theirs finalized, then we are really going to have some pertinent, up to date information that we desperately need. But I think it shows pretty much all around, like Joe, you're on that Cedar Lake rehab, and if you remember, take 1990, you'd go by Cedar Lake, and even the smell in the air and the algae, and through the watershed and the minimum tillage, most of your chemicals now are actually environmental friendly, and Cedar Lake is pretty well cleared up, isn't it, Joe? So
that elm treatment.
that's the kind of progress we need, and if we can encourage people, you did your own testing and it went very well, and anybody can do that. You want to give a little how you did that? I think you would.
Well, I just went to Tanya, got the water test kit and sent it in. But we built our home 20 years ago, so I was able to compare the test results from when we first put the well in to now, and they're pretty much the same. So we were fortunate there. But our lake does a really good job of water management too, so Deer Lake. So it's, that helps. I have a question though. So the cost that you're showing here, the staff hours, that's not additional cost because we're already paying staff, right? But but that means other things get pushed, correct?
That's correct. It would be kind of a reorganization of priorities within our work plan. So
the additional cost to the county really is the material costs, and then in the case of the Cadillac one, it would be hiring the additional FTE to be able to work on this.
correct. And one thing to add to that, in my research here on this topic, I have found a possible grant through the Department of Ag, Trade and Consumer Protection that would cover material costs, potentially. And now that is if we were to get approved. The Department of Ag has realigned some of their segregated fund funding. And this was money that used to be intended for nutrient management planning. And it's been, quite frankly, a hard sell for many years. And there's underspending in that pot of funding each year. They've since kind of rethought that funding program, and they're calling for innovative environmental projects now. And there is a grant that the deadline is February 15th, and I've asked if groundwater testing materials would be eligible within this grant, and they didn't indicate that it was ineligible. So we could apply for up to $50,000 for material costs.
It would cover it.
So yeah, looking down these options, we'd only be looking at the material costs. And again, it's contingent on being approved, but up to option C, we could potentially have our material costs covered for any of these, options.
Then the question becomes, what do you reprioritize? So what gets pushed so we can do this?
And that's our liability right now.
And that would be up to us and our departments to kind of realign the work plan. And I will say that groundwater quality concerns and improvement is a goal in our 10-year land and water resource management plan. So I don't think that it would be too difficult to realign and make this a priority. It basically already is in our 10-year plan. We would just be moving on it a little bit sooner than we would have normally, and that's okay by us, because this would prompt some the achievement of some of our deliverables in a short amount of time.
Well, thanks for your presentation, Eric and Bob, and everything you do. Was there any more questions?
Go ahead.
Go ahead.
I have a question.
Yeah.
Is there anything that you need from us or from the county board to move forward in applying for the grant?
We talked about that this one, do you mind?
Go ahead, Bob.
Okay, yeah. So you might ask yourselves, what's the next step? You could choose one of these options because of the tight timeline for the grant. Again, the deadline is February 5th. You could choose one of these options for us to pursue contingent upon the grant award. And we could, and that's one of the sort of extra layers to this. I would need to take this to Environmental Services Committee, primarily because that governing committee oversees our department here. But that's something we could do as early as the January 20th meeting. I'm still drafting the final agenda. So there's that. And then also, parallel to all that, you all as a board could draft a resolution for the county board outlining this project parallel to that. So in other words, if we are given the directive to bring to Environmental Services, I can certainly do that. We simply need to know what your option would be. And then maybe above all, if you don't mind, it would be helpful for us to understand what exactly is the goal. And what is the goal of this program?
Well, I think, Bob, I think right now we're right in the middle of testing, like in the vaccine, and I think it's up to us to encourage people to, if they would like to do some testing. Everybody knows it's important in our environment, and encourage people to do it on their own, like like Supervisor Kelly. And then if we can go ahead with some grants, we have to have cooperation in our departments, like your environmental services. They're the ones that would apply for a grant. And I'll keep on in touch with the Wisconsin counties. And I'm sure that St. Clair County is going to have to be completed first because they go everything by regions. But once they get theirs done, I bet not this year, then I think we'll be in line. I think we have kind of a priority being in the metropolitan area. We are a part of the 9-county regional city metropolitan area. We should be more active in my case, that we should be more active even attend some of those 9-county regional planning parts.
It sounds like.
A third option would be, if we weren't able to secure the grant to subsidize the material costs for this program, well, this obviously will take some levy dollars. So we could bring this back come this summer, fall, during the budget development process and to make it an initiative for 2020.
That's what it's all about.
So, yeah, so I'm just providing you all with some options here.
I would hate to jeopardize anything. We're right in the middle of this pandemic, and our staff people in every department are really, really stressed out. And I wouldn't want to put anything else on them right at this time. I think as time goes on, we can work into an option.
Should I make, I'm just noodling this idea of a motion. As a previous grant writer, I know how important it is to show a grant that you're moving forward on a particular recommendation. And
Yeah.
so I would make the motion that we recommend, however you want to word it, for the grant and to environmental services to send the message back to them that we're interested in option D. And then we start to put the funding package together with the finance of the grant. But you can say to your grant people, you have a committee that's really supportive, and you can craft that language around how the Health and Human Services is really supportive of this, and we want to move forward with it. And maybe by then you have something from environmental services also. So I'd like to make the motion in that context for this committee to support option D, and then put our funding package together as you guys kind of, as it becomes clear to you as.
Do you think, Amy, it's important to really initial a option right now?
Well, I do for the grants, and I do for environmental services. I think.
You think we have to specifically, or?
I think so, because they want to know more articulate.
I just wanted to know
Yeah.
that in your motion. So present your motion to Madam Clerk.
Right, is something that information you need to be aware of. Environmental Services Committee, I believe Sharon is on that committee.
Yep.
They did put on the agenda for the upcoming meeting a resolution. I'll distribute this copy, which is proposing something along the lines here of A or B, where we are.
Yeah, we certainly need a dual cooperation here because it goes through, I think it starts with us and goes.
What this is an incentive to encourage people to have their well tested. So we wouldn't pay for the entire test, but it would offer that we would give them like here it says a $5 rebate for anybody who does it. So. Yeah, there's two there if you could share that with me. Small amount, but anyway, that was introduced.
Yeah,
Not even introduced. It was put on the agenda for this upcoming. So I
So
just
this
wanted
is on the
to
upcoming environmental services or full board?
to discuss at the
Yes.
environmental
Okay.
service. Has not been discussed yet. I just thought I'd pass this out so you knew it was out
Okay,
there.
so Amy, I would like, I don't know procedurally, you can direct us how to do this, but I'd like to amend your motion.
Okay.
Okay, and my motion would be, is that we would make a recommendation to Environmental Services Committee to proceed with applying for the grant with option C
I would,
in mind, and that the purpose of this would be to update 30-year-old water quality information. So the goal of this and the outcome of this is to update information that's 30 years old.
Did you say C or D?
C.
I said C.
And that's the one without the LTE?
Correct.
Yes.
Correct.
And that fits actually right in with this thing that you just handed out.
Right,
So-
it would be more achievable.
So we have the environmental services and our health department working
Together.
together.
Yeah.
So,
Clarify option C,
C.
C as in cat.
Yeah,
C
second.
is in
And
kitty cat.
Rita seconds that.
okay, you want to refer that to Madam Clerk and then she'll read it back? Well, first of all, do I have a second?
I second
Okay, seconded by Rita McKee. And discussion on the motion presented to the clerk so we know exactly how it's written. Do you have any language on that?
Yep, you
Madam
want
Clerk?
a motion to recommend the ES committee to proceed with applying for the grant for option C.
Simple enough, is that correct?
Update 30
Can I have that?
years.
Oh, yes.
With the goal of updating our 30-year-old information.
Everybody heard the motion. All in favor of the motion as presented, say aye. Aye. Opposed? Motion carried unanimous.
One last item. I have the grant application here, and it does ask for additional information like letters of support or resolutions and things like that. So those items would carry a fair amount of weight when ranking these.
Yeah, I think that's one of the reasons why we have this motion.
Do you want a resolution from this body also?
Well, that really speaks as a resolution, doesn't
I
it?
think, yeah, eventually we would need one, but
But will we meet again in time for your deadline? So we're good?
So
eventually.
Your deadline is.
It's February 15th. Well, it's possible that we could apply with the note that we'll send the resolution as it goes through.
So if we need anything for February, let's do it now because we won't be having a meeting in February.
Oh, we need then,
We never have, and if something comes up that's important with the COVID and that, we never know, but traditionally, we don't have a meeting in February. Okay.
okay, so I don't want to like go outside of, the process here, but it would be helpful to have a letter of support from the Apple River District. I'm on their board. It'd be helpful to have a level of support, say, from the Wapagasset folks. It's appropriate for staff to reach out to those entities. I don't have to worry about that. I'm supposed to be doing that or anything.
We can do that. We can reach out to those organizations.
Okay, perfect.
Well, say, as long as you're on the Apple River board, then maybe you can help out. He needs all the help he can get. Maybe you can reach out to some of the other watershed chairmen
Sure.
and just get them a note of.
Too, I just wanted to make a comment as far as the staff and the workload of the staff and shifting that workload. When you get a grant like this, normally you have plenty of time to use this. And so in a best case scenario, perhaps hopefully some of the pandemic and COVID issues would be lessening by the time this came online for the staff to work on it. Keep our fingers crossed.
I think they're pretty well loaded for the year already.
Yeah.
Well, it does, like Eric suggested and mentioned, these watersheds are considered priorities within the lake management plan. So this really meets the objectives of the department.
Yeah.
Eric, did you have anything else before we give you?
We haven't finished this resolution piece, and Leah, can you help us on this? So for this grant, I would love to have a companion resolution from Environmental Services and us. And if we're not meeting in February, could we do something by email and get something approved?
Well, so if you wanted something drafted and either the administrator or the chairman gave me the thumbs up, we could draft something, amend the county board agenda for next week, and then it would have to have a 2/3 majority to bring it to the floor if you felt like there was some level of consensus. So that would be something that theoretically could be done to just fast track it. If it's just a letter of support for applying for this grant, that, you know, the full board is supportive of something like that, we could do that.
Bob, what do you need?
You know, again, we just need the directive to pursue the grant, and which we have now. If the grant's awarded, then we can pursue the program. But again, there's going to be a need for that approval eventually at the full county board level. So I think parallel to all this, it might be a good idea to draft a resolution as it makes its way through the governing committees and eventually, yes. I don't really see the sense of urgency for January, but it could be a county board agenda.
The other, just from sort of a practical standpoint, is staff could draft a letter for signature of the chair of this board, of the Human Services Board, and then also draft some type of similar letter for the chairman of Environmental Services, indicating that, you know, their committee and this board, which really makes up, you know, quite a big part of the full county board, are already in full support, and we don't anticipate, you know, something like that, issues going forward, resolutions will be coming, that sort of thing.
I think the initial committees, I think they carry the most weight. That's what they want to see. And I think this committee, the environmental committee, and the administrator's approval, I think that really suffices the process.
I know there's
As long as you're good, you guys are good with it.
there's a lot of grants from the DNR and DATCAP that are already listed on our budget resolution from November. And I don't know if, you know, those would carry out. This grant isn't specifically listed in there, and I know a lot of them are, but I don't know if that resolution could work in place of, you know, a newer one.
Yeah, we'll talk about that.
We could look at that.
Because I don't see anything that has to go to the full county board.
No, because as long as we can support this in the application for the grant, that's outside of the budget.
As the administrator, you know, you have the support of the committee. And that's just usually the process that they wanted. But you're the administrator. I'm not sure there's going to be a county board in February either. There usually isn't. I think there could be.
Yeah, Chris wants one.
I think the plan is to have one.
Oh, okay. Okay, Eric, is,
Last thing that I had was to thank you for your consideration and support in this. And
Yes.
it's a pleasure visiting and presenting to you again. So
that's our goal, to work with the committee.
I just have one quick question, if I could. And this isn't something we can answer now, but say we find wells that are found, wells that are contaminating the lake or contaminating the watershed. What happens then? Who's responsible for fixing this? Because I know of some right on my lake, and they've been known about for a long time. But who's responsible for enforcing that?
yeah, I think it would be up to the owner, you know, to and us to present some best management practices or recommendations on how they could handle that. But it would
There's
be
no authority.
not that I'm aware of. And I think this would be strictly an outreach and education effort on our end, and there would be no enforcement. There are some programs that we do have for cost sharing to decommission wells if they are contaminated and they want to, say, drill a new well. We can provide 70% cost sharing to those people to have that old well, contaminated well, decommissioned and make that go away. And their new well hopefully is deeper and into a clean aquifer. So those are some of the things that we could have a dialogue with those affected landowners.
That goes under the zoning, Rita. Jason Cheez he has to issue an order to cap a well, and then they have to have permission for a new well. And yeah, there's caution, like the old manure pits and everything. There's cost sharing and all of them to get them all.
But it's the education part, because I've asked this question many times before. Okay, we go out and test wells. My well is bad. Where do I go? What do I do? And that's the education part that you talked about in here. It's being able to have some of those avenues for them to use.
I think the information piece of this is the biggest, most important piece of it, because quite frankly, there's a lot of citizens that don't know what their wells are testing at, and they could be of concern, and I would think that's something they would want to know about. So that would be a priority in any of these efforts. So thank you again.
And I appreciate your staff and I appreciate our committee being aware of this. I mean, well, whatever, there's so many things, there's birth defects and disease and everything else that it all depends upon our good, clean well water. Thanks, Eric.
Thank you.
Bob. Tanya, do you want to wrap up the rest of our agenda?
Well, I see we have the update regarding operation ordinances regarding CAFOs. So I don't know, I think Supervisor Middleton, you had requested that be kind of a standing order on the agenda. So,
Well, we talked about it last week and, or last month, yes, but are we not having any, I mean, Vince, you said we could use it as an idea to give an update, and now we're not going to have one, or what, I guess I'd like to know where we're at with Operation Ordinance.
That's kind of where I am too. No, we met after the last meeting, Bob and Malia and I, and based on what I think you're asking for, findings of fact to support the operational ordinance, and based on what DATCAP and the DNR, the information we've gleaned is we need to have local specific information here to this county. So if it's in regard to a swine capo, the first question is going to be, they're going to say you can't designate swine only. So we need to have some type of data that would say, because of this data here in Polk County, we know that swine are detrimental to our health or water or air, something like that, so that we can make that. So I guess the question is what do we want to do as a committee or a board to say what specific types of facts do we want to go after?
Well, I don't know that it's my job necessarily to figure that out, but I have been watching Burnett County and some of their progress and reporting and some of the other reports that are coming out, and I'm seeing some pretty robust findings of fact, and the specificity discussion about locality. One way I'm hearing people starting to talk about it is that we know what swine CAFOs do because we can look at Iowa and Pennsylvania and North Carolina. We have a large body of data there that we should drill into. It's already been drilled into. I mean, we have it. And so, and the local piece is that we need to show why it's a problem here. It's sandy soils, it's depth of groundwater, it's drinking water. I mean, partially this testing stuff feeds into that. So we can say, oh, this little section we know already has nitrate problems. We know some of that stuff. That's the kind of sort of body of research that we need to put together. We need to have it for the CUP too, because we're kind of on thin air without having any findings of fact. We can't just tell a permittee random conditions and not support it. So I really want us to put together an operation ordinance that has support underneath it. So we have this foundation of why we came up with this stuff. And Burnett is really doing a fairly, it seems like a really good job. They just finished their report. The committee presented it to the board. The board said there's more stuff to do. They divvied it out to other committees. So they're kind of still in progress. But they've spent a lot of time digging through what their findings of facts are going to be and what are supporting it. The swine only piece, we have to be really careful on, and we have to make sure we build a really solid case as to why swine manure acts differently. And there's data out there. It does act differently. It contaminates more. We have the viral piece where swine and human interface. We have that whole body of information is the virus piece, how it transfers between pigs and humans. And right now with our current pandemic, I think that's more near and dear to our heart than it was a couple years ago. So I just want to know who's in charge of the operation ordinance. And, you know, in September, we got this resolution that said, and keep working on it. So I just want to know where we are in the and keep working on it. We got a draft. DADCAP gave us the predicted answer back. To me, it's a map for how we can tighten up our things. And then we build our findings of fact.
It
And we present it to the
almost
board and see if
seems-
it passes.
if we're asking for this collection of data, would it make sense to, rather than just have a proposed ordinance written, is to have some directive from the board that says this is the direction we want to go? Start looking into this.
Well, that's what we said in September.
But we didn't get any board approval on that.
We passed that resolution.
I don't think we passed a resolution.
Yeah, Mike made an amendment. What was that we did? We had a resolution in September that said, we passed the CUP and we continue to work on.
Continue looking at it, yeah.
Yeah, that was the key.
So I guess the question is, what does that mean? So let's take the operations ordinance as it exists without the local specific. Have the board tell us, yes, they want us to keep working on it. I mean, I think at this point, we drafted the ordinance and now we're saying, okay, now tell us why we need this ordinance. That's going to make the ordinance very hard to defend later on, but that's where we are. So if the full county board tells staff, this is a priority, go spend levy dollars to gather this information, then we know we've got the full board support. So I think that's where.
Isn't that what we did in September?
The full board has not touched the operations ordinance.
No, I know, but when they said continue to work on it, did they say come back, or we say come
I
back?
guess the question is, what does continue to work on it mean?
It
I mean,
seems
is
like we
it the
should come-
operations ordinance that we're going to continue to work on?
Well,
Yeah, that was.
I want to interject something here. Now, on our counties, this is another thing that's on our counties association. What happens, we have the steering committee, and then some county will bring a topic up to the steering committee. And then we'll vote on it on a Zoom. Normally, we'd be down at Stevens Point. So what we want to make sure we eliminate is duplication. And our state has, we're working, the State Department of Agriculture and Consumer Trade is working on a CAFO ordinance. And there is 2 counties that are pilot counties right now. And the thing you gotta avoid on here is that we don't have something that we gotta defend ourselves that can actually break a county in legal fees. So I think what we want to do is when the state comes up with their final draft on CAFOs, we'll be a part of that. We'll be protected on that. And then we'll want to look individually to see that we fit and meet each one of the criteria parts. And I think we will. And I'll give you a report on, that'll be on the 11th of March, and so I'll give you a report on that. I'm not sure, when is our March meeting? I'll be here for the March meeting.
Third Tuesday.
They're due. I don't know if it's after the 11th or before that. I'll give you a report on that. So our whole state is working on.
The 9th.
Well, yeah, I guess the thing that having read the articles about what's happening up in Burnett County, I think that's one area we could say, could you provide us? But theirs is, it's unique. They're not unique. It's about all livestock.
No, ours is the one that's unique. Yeah.
And so Burnett counties, when you say they're doing, they have studies, we had our former health director provide reports to, here's, the effects of CAFOs. And he talked about livestock, and he talked a little bit about swine. So we have that information. The question is having gone through the last year and a half, do we want to continue to, I guess, delve into this at great expense and time when we aren't the researchers, so to speak, right? So the county is not going to go out and do the specific research for Polk County.
We could. Why couldn't we?
We could, but that would take the direction of the full board.
Yeah. And in September, the conversation in September, as I recall it, was, here's the CUP. It covers 2/3 of the county. It leaves out 1/3 of the county. And it doesn't include, Lakeshore is still in that third that's left out, because we know now that CAFOs are allowed to spread on Lakeshore in shoreland districts with not frozen ground, not in the winter, yada, yada, yada. But they can still spread. So that's still 1/3 of our county that's not covered. So we left that CUP discussion saying, okay, let's look at another part of the rest of the county. And the operation piece is a different sort of animal as opposed to a CUP. It requires and regulates or allows us to have a say in the operation side of it. And so I know the state has an overlay and there's a state component to all of this, but we can also step to the plate and have a voice on, here's how we think in our county an operation would look like, but we have to have the research to support it. And it's not like we need to have scientists, we just need to find articles and research. It's not super high level science.
Vince, if you remember when Jeff Jackson was here, he's the permitter, and he had a very strict criteria of what he would allow permits to go forward and not. And any lakeshore area was off limits. They never get a permit.
Right. And
They don't have permits to be there, but they can spread there. I talked to Eric about it at length because I was trying to understand the language that I was reading in the statute. They can't have a nooner pit there. They can't have an operation there. They can't have any of their operations sited in the shoreline, but they can use it for spreading. I think the point today is, like, what do we do next? And we left September with this idea that we were going to do something next. And this amendment that Mike put in there passed. And it told the board, go forth and do something.
And that's when we wrote the ordinance and submitted it to DACTAP, who came back and said, here's what you need.
And now we take it to the next step.
So now the question is, I think that's where we're going to ask for the full board approval to say, do we proceed with digging into this type of information? I think
we should look at that September language and make sure, because, going back and forth to the board takes so much time. And, what if we just presented them something? It'd be nice if this committee could do our job and finish this task, which was to do the operation ordinance, and send it to them as a completed document and then have them up or down it at that point, instead of going back and saying, are you sure you wanted us to work on this?
Well,
okay, go ahead.
I think the nuance is trying to tie swine only,
Right.
Polk County specific, and what does that mean? Because when you're looking at Burnett County, they're going CAFOs and livestock in general,
Right.
and then they can look at the specific soil types and watersheds and everything in Burnett County. We have to try to do that, but then delineate swine only. So taking data from Iowa and other places where they've had issues with swine CAFOs, and then trying to tie that to something specific to here, but saying we're not going to worry about bovine CAFOs. It's that nuance that is beyond, I think, where we can put pen to paper. That has to be some type of expert. That has to be someone that we either contract with or find the resources in-house if they exist. But that's the part where that's going to require likely a budgetary amendment if it's going to happen this year, I would think, unless we just throw some, peer-reviewed articles in there and cross our fingers. But that's not.
That's kind of what we did when we collected all the data and had our bibliography and our big, thick stuff. So,
You mean the report?
I mean, you can pick and choose stuff out of there that say, we think this will apply. Now, has there been any new data come forward since last August? I don't know.
It seems like, I don't know what Brian Kaczmarski pulled together. I didn't see that.
Wasn't it Hobbs?
So
Brian
we
presented.
have that, and then we have oddball stuff from, it just seems like there's plenty of swine-only stuff, and everything that I read is like swine manure is different. And if we can figure out a way to argue that.
But we have to argue that it is different here in Polk County.
Right, because we have certain soils, we have tons of tributaries. We are in a National Wild and Scenic Riverway where we have tons of water and rain running off. That's what's unique to us. And that may be all we need to say. That's compelling enough because that ties us into state and federal statutes, state and federal regulations. So that piece, I feel like, and then we have your research with the WCA that said we could do swine only because we don't have a swine plant here or however that was that you were explaining to us why we can do this. So I feel like we have a fairly robust bunch of stuff that just kind of needs to be knitted together. And you have a funny look on your face.
And that's what I'm at.
I want to wrap this up now. We've had quite a bit of discussion and we've been on this for a year and done some things. And I want to leave the points up to you is to see what's legal. We certainly don't want to move anything that's legal.
Don't make Malia have to do that. We should just
Hey,
decide.
Opine
she-
ad nauseam.
That's on her plate. That's constant. And so we want to see if there's anything new that is legal that we haven't covered. And also, we got to look at our duplications. We don't want to be doing something that we have a duplication on. Interfere into another jurisdiction like the state has, and we've always got the right to be more restrictive if it's legal. But a lot of those parts that we would like to see aren't. And so between Vince and Malia, if you see anything that's new that we can think the committee or the board wants to proceed on, then bring it to our attention. It'll be on the agenda.
I could imagine some type of lobbying resolution, where the county tells the state that they support either more local control or funding for enforcement.
There's two pilot ones right now.
Something like that where it's asking the state to make some changes.
And I think a search of any new data or studies, and Amy, you mentioned several things that you're reading from different organizations. Forward that to me. Let me, and at this point, it's going to have to reach that level because what we did was send off to the DACTAP, and DACTAP came back and said, "Here's where you got real problems." And a quote from me or anybody isn't going to do it. It's going to be, do we have something that would satisfy those concerns that we think would reasonably do that?
DATCAP is the key organization on all of this.
Well, They're just one organization.
Yeah.
They're not gonna be the, be all end all. We can
Oh, no.
always challenge that.
But they are very
Okay, so the next steps is maybe I just work with Malia and Vince on where we go from here, or Vince on this. I mean,
Yeah.
it seems like, I think we're really close. I just feel like we're right on the cusp of just pulling stuff together. And I know I'm in my, I'm not a legal, but the DADCAP letter to me wasn't like, take your toys and go home. To me, it was like, oh, here's the roadmap for how we make it better, and we just told you what
That's
to
what
do.
they are, I'd say, a roadmap.
Yeah, so now we just follow the roadmap and do what they said and just ding through it.
Well, they also offered, right, to work with us to create a defensible ordinance. I mean, but
That would
it wouldn't be this ordinance. It would be something,
Would they,
citing. Most likely.
would it be swine only or no?
I don't think, no matter what we do, I don't foresee DADCAP giving a thumbs up to swine only, given where they are, unless we were truly able to come up with that unique tie together for here in Polk County.
How did WCA think you should position it when they said you could do swine only? What were they thinking?
That's the same thing that we said right at the very beginning. You can do swine only as long as you can defend why it's different in your local county.
And I think we can.
We had the national data that said that there are diseases that might be more easily communicated to humans. And that was the argument.
We live in this amazing tributary, like the water piece of this is what I think is a big thing for us to hold on to, because we have so many tributaries going into a national scenic riverway that's very unique. We're not a flat Iowa cornfield. We're very dynamic. We have high and low groundwater. I mean, we have a lot of stuff to argue why we're good. So maybe I can think about that side of it, like the tributary water side of it.
Bring in Eric.
We have Eric, right, exactly. I mean, he would be way more qualified and really smart about how we could position this, because I think that's how we position it is from a watershed, tributary, water quality perspective, and that we are unique. I mean, the head of the tourism for the whole state of Wisconsin came up here and was like, oh my God, look at all this water. So we should use the, oh my God, look at all this water as a way of arguing we need to protect our water and the tourism side of it. And so I really think if we think of it that way, it can get us noodling on how we connect swine only and the water and the operation.
Well, we're certainly got it on top of the table.
That resolution is 3720, by the way, from September.
3720. Thank you.
Tanya, do you want to proceed on number 8?
Yeah, we have, it's a
Right now, we're looking at a March meeting.
March meeting, we have Golden Age Manor, child support, and VSO updates on the docket.
When do we have to tour the Golden Age Manor again?
I don't know when that is going to happen with COVID.
I just had a question. I've had a lot.
Yeah, I know Dana likes to have us come down and have our meeting there once a
But
year.
we'll have a report.
Yeah, she's up to give a report along with child support and the Veteran Service Office. CAFO update is a standing, if there's anything to update, COVID update, nuisance, human health ordinance update. And then if there ever is a legislative event again, that's on the agenda as well.
Yeah, our legislature will be in session. We made a lot of progress when we were down in Madison that last time.
And
That was very beneficial.
right, so I am not going to be at the next meeting, so I'll have Kathy Gingras, our business manager,
Yeah.
run it, but we'll also be able to introduce you to our new health officer, which we probably should have had on the agenda. So we've been able to hire a health officer. She's coming on board February 8th. Her name is Jean Schultz. And I know that she is so excited to come here and work with us. So she's from Milwaukee.
Vince, did you have anything to add to the March agenda?
I don't.
Okay.
I have a question. Is there anything we're going to need to do in March regarding the water quality study grant? Anything that the staff is?
We'll have an update on
Need us
that.
to act on?
Certainly we'll have an update and we'll probably, well, certainly we'll have our application submitted by then. Assuming it
Okay.
gets.
I'll put it on there.
Okay, thank you.
Move to adjourn
Maybe move to adjourn.
by Supervisor Kelly. Second by Amy. All in favor, aye?
Aye.
Unanimous. And
Thank you.
I hope everybody can get a vaccine shot by then. I'll tell you, once you get your vaccine shot, it gives you a different feeling. You really, I was probably the most apprehensive, and they talked me into it real quick, and